The effects of alcohol. Here are some statistics. The National Survey on Drug Use and Health 2013 survey found that around 52% of Americans 12 years old and older use alcohol. 6% of that population are heavy alcohol users. In the past month, 23% of that population stated that they have engaged in binge drinking. This is consuming a high amount of alcohol in a small amount of time. 11% have admitted to driving a car under the influence at least once in the past year. About 8.7 million Americans who are under the legal drinking age are current alcohol users. 5.4 million of that population are binge drinkers, and 1.4 million are heavy drinkers. Effects of alcohol on the brain. Alcohol is a central nervous system depressant drug. It depresses an area in the brain that is normally an inhibitor, resulting in an illusion of stimulation. The depressive action goes downward into different regions of the brain. It then blocks chemical signals between brain cells, which leads to symptoms of intoxication. Some of those symptoms include difficulty walking, blurred vision, slurred speech, impaired memory, and slow reaction time. Effects on the brain depends on how much and how often one drinks, their age, gender, genetic background, family history, and health status. People with alcohol dependence experience brain shrinkage. This is where the frontal lobe of the brain shrinks. It affects the ability to think normally. It also affects the wiring in the brain that is used by other regions to communicate with other ones, and affects part of the brain that allows neurons to communicate with other neurons. Once the structure of the brain has changed because of alcohol abuse, it could damage the brain forever. Heavy alcohol use over time. The brain adapts to block signals by responding dramatically to neurotransmitters. After alcohol is gone from the system, it causes the brain to keep activating the neurotransmitters, which then causes withdrawal symptoms. It also causes problems with verbal fluency, working memory, problem solving, attention, and impulsivity. There's also a possible development of alcohol-related dementia, which is about 10% of dementia cases. Some physiological effects of alcohol include tolerance. This is when drinking one's usual amount, but not getting the same effects. This results in drinking even more alcohol to get drunk, and it's a continuous cycle of drinking more alcohol each time. There's also withdrawal. This can include insomnia, sweating, mild agitation, anxiety, nausea, vomiting, severe hangover symptoms, and possible seizures. It also causes liver damage and cirrhosis, which is a scarring of the liver. If the liver is scarred badly enough, it cannot function anymore. There's also hepatitis, which is an inflammation or swelling and irritation of the liver. It causes abdominal pain and yellowing of the skin. There is also what I think is called the Wernicke-Korsakoff syndrome. So this is caused by lesions on the brain, which are a result of vitamin B1 deficiency. Its most common cause of it is alcoholism, because alcohol prevents vitamin B1 absorption and storage. It causes double vision, loss of muscle coordination, confused mental state, up and down or side to side eye movement. There are also nutritional deficiencies such as iron, thiamine, which is vitamin B1, and vitamin B12. This can lead to problems such as fatigue, depression, forgetfulness, hair loss, heart trouble, and also nerve damage. Alcohol use is also linked to different types of cancers. There are cancers of the pharynx and larynx, and breast, stomach, colon, pancreas, and rectum cancer. It causes hypertension, which is also known as high blood pressure, causes heart problems, seizures, depression, anxiety, type 2 diabetes, ulcers, damage to the pancreas, and nerve damage. The impact of alcohol on violence and aggression. So according to a study in 1991, more than 50% of physical violence cases had alcohol as a major factor in it. Around 50 to 60% of murders were committed after alcohol intoxication. There are a few theories behind that. The first is the disinhibition theory, and this is where alcohol impairs normal cortical mechanisms that are responsible for suppressing aggressive behaviors. Next is the cognitive expectation theory. This states that expectations about the effects of alcohol creates aggressive behavior. Next is the alcohol myopia theory, which states that alcohol reduces ability to detect social cues that would have normally led to appropriate behaviors. The impact of alcohol on driving. According to Leventhal, reaction times are slower, the coordination necessary to steer a car steadily is hampered, and the ability to stay awake when fatigued is impaired, but the major way that alcohol impairs driving ability is by reducing the drinker's awareness of peripheral events and stimuli. In 2016, 10,497 people died due to alcohol-impaired driving crashes. In the same year, more than 1 million people were arrested for driving under the influence of alcohol or narcotics. Every 51 minutes in America, someone is killed due to drunk driving. Here are some more facts on the impact of alcohol on driving. Between 50 to 75% of people who have had their license taken away due to drunk driving still drive illegally without their license. In 2010, 17% of fatalities among children age 14 and younger happened due to driving under the influence of someone else. About 75% of crashes between midnight and 3 a.m. involve alcohol. On average, 2 out of 3 people will be involved in a crash dealing with alcohol in their lives. Drunk driving deaths and damages cost around $52 billion a year here in the U.S. How blood alcohol content levels affect driving. So having a BAC of 0.02 causes a lack of judgment, relaxation, and inability to multitask, and altered mood. A BAC of 0.05 causes exaggerated behavior and lack of coordination, inhibitions, and alertness. A BAC of 0.08 causes reduced muscle coordination, lack of self-control, lack of judgment, and reduced ability to concentrate. Having a BAC of 0.10 causes poor coordination, slowed reaction times, reduced ability to control the vehicle, slurred speech, and reduced ability to keep a vehicle in a lane and brake at appropriate times. Having a BAC of 0.15 causes extreme loss of balance, impaired vision, and very little muscle control. One treatment option is inpatient treatment. This takes place in a psychiatrist's hospital, and there's also specialist alcohol addiction treatment centers. They have 24-hour medical and emotional support. It is designed to treat serious addictions. It has a very high success rate, and there's constant medical care. Then there's outpatient treatment programs. So these are programs that people can attend a couple hours a day or a certain amount of hours a week. The patient gets to stay at home, but goes to the treatment during the day. They must visit a facility or physical and mental checkups. It also includes 12-step groups. There are also alcoholism support groups. There's Alcoholics Anonymous, which is a very famous one. This is where people can share their experience and help others going through the same exact experience of recovery. Research has shown that participating in support groups is more effective in recovery than participating in treatment by oneself. There's also Smart Recovery, which is a community-based self-help program where meetings are facilitated, and they have a large network of over 500 meetings. There's also Secular Organizations for Sobriety. This is a nonprofit network of autonomous, non-professional local groups that help others maintain and achieve their sobriety. They hold group meetings everywhere and also provide online ones as well. More treatment options include cognitive behavioral coping skills therapy. This is used to help correct self-esteem and self-defeating thinking. There's motivational enhancement therapy. This helps improve readiness to stop drinking. And there is also disulfiram, which is also called antabuse. This is a pill taken orally each day that gives people effects such as rapid heart rate, nausea, and vomiting when they take it and combine it with alcohol to try to get people to stop drinking. And here are my references.